Well, hello, and welcome to the Rise of E-Cigarettes, Implications for Public Health webinar. My name is Chelsi Bennett, and I'm pleased to be facilitating this webinar today in my role as a board member for Prevention Connections and a friend of Virginia Foundation for Healthy Youth. We are thrilled to have you with us as we learn more from Dr. King today later in the program about youth e-cigarette use and what can be done. So first, a few housekeeping rules for us. All microphones are muted, cameras are turned off, and the chat function is disabled. However, the Q&A function is live, and we are encouraging you to put your questions in the QA box throughout today's program, because at the end, we do have an opportunity for questions and answers with Dr. King. I also have the honor of serving as the Government Relations Director for the American Heart Association and American Stroke Association. AHA is one of the leading authorities on the impact of tobacco use on health, so much so that on the national level, AHA's Tobacco Center for Regulatory Science is one of just 9 centers nationwide that is currently funded by the FDA and NIH to conduct groundbreaking research on effective tobacco product regulation. We provide vital information to organizations, to school boards, to parents, to advocates. We continue, again, to be one of the leading authorities to be able to provide tobacco health related information. So much so that one of our efforts has been around vaping and ensuring that not only parents, but also teachers have the necessary resources to educate youth and teens while they're at home and while they're at school. On the federal level, our advocacy team at the American Heart Association was on the front lines for Tobacco 21 legislation last year, as well as they continue to lead advocacy efforts to ban the sale of flavored tobacco products, including e-cigarettes, cigars, and menthol cigarettes. Here in Virginia, where I lead advocacy for the Heart Association, last year or earlier this year, during the General Assembly session, along with several other national partners, we were able to introduce some comprehensive tobacco control legislation. We say comprehensive because many folks in the industry said that we were disrupting the system, which I think is a good sign of how strong the bills were. However, the bills were continued, but we are so excited for the upcoming session because this past session allowed us the opportunity to educate and engage with Virginia lawmakers, so senators and delegates here, many who were new on why tobacco control policies are so important and why they're needed, especially as we look at youth prevention and youth cessation. So when we think about what's happening here in Virginia next year, the American Heart Association will be leading efforts to advocate for legislation on tobacco retail licensing. We know that this is the infrastructure for successful tobacco control policies, and it was one of the bills that we introduced last year, and we will be focused on that throughout the coming months and as we prepare for session. And so if any of you who are on today's webinar, if you're interested in learning more about our efforts, feel free to reach out to me. You know, Virginia is the home to Altria, but we know that tobacco control policies are important no matter what state you're in, but even more important here in Virginia. And so we will continue fighting the good fight to ensure that there is comprehensive tobacco control policies that are strong and effective to ensure that we are keeping our youth away from these products. And so I am excited for what's to come. I'm excited for the opportunity to engage and to educate lawmakers throughout session as we engage them. There were many different responses, but as we laid out the facts that many of you all know, and even some of the facts that we'll hear from Dr. King today, it was just so great to see, you know, eyes perk up, eyes open up, ears perk up as they learn more of the truth. They learn more about what science says and how nicotine continues to negatively affect our bodies. And so I encourage you, if you're interested in advocating or just want to share your story, please feel free to reach out so that we can have all hands on deck. The more people we have at the table, the more stories, the more physicians and doctors and teachers and parents at the table, the stronger our voice becomes there at the General Assembly. I know there are several of you who are not from Virginia, and so these efforts need to continue in your state. You need to continue to advocate for tobacco retail licensing, flavors ban, whatever that is. I want to encourage you to keep up the good fight, because we're all in this together. And as we'll see more later, strong tobacco control policies at the state and federal level are just some of the pieces that help us as we look to prevent our youth from having access to these products. We are here today both because of Prevention Connections and the Virginia Foundation for Healthy Youth. They both are committed to promoting healthy living, including tobacco use prevention for youth and families. With us today on the line, we have Marty Kilgore, who is the Executive Director for the Virginia Foundation for Healthy Youth. Those of you who know her know how amazing she is, how passionate and dedicated she is to the foundation and the work around youth prevention. And then we have Robin Zacharias, who is the board chair for Prevention Connections on the line today. And so I want to say thank you both for your leadership. Thank you for ensuring that something happened today, because we want to ensure that we're continuing to educate and engage those who are part of our networks. So many of you know that typically Prevention Connections, as well as the Virginia Foundation for Healthy Youth, we would co-hosted the Reduced Tobacco Use Conference this past spring. And unfortunately, as we all know, COVID-19, that event did not occur. So we are pleased, though, that we're able to bring to you one of our keynote presenters today. You all saw him. You saw him on the flyer, which is, I'm sure, why you signed up for today's event. And so we all have this concern about youth e-cigarette use in the form of Juul, puff bars, and whatever the next product will be. So I am just thrilled. I'm excited. I hope you all are excited, because we have Dr. Brian King with us today. He is the Deputy Director for Research Translation in the Office of Smoking and Health within the National Center for Chronic Disease Prevention. He provides scientific leadership and technical expertise related to tobacco prevention and control, and he has done this for over 15 years. So webinar participants, we truly have an expert, someone who is coming with us with knowledge, experience on this issue. He has authored and co-authored over 175 peer-reviewed scientific articles. Friends, get your pens and paper ready as we hear from Dr. King.
Great, thanks, Chelsea. I appreciate the introduction, and I also appreciate the opportunity from the Virginia Foundation for Healthy Youth to do a virtual keynote for you all today. I understand that a lot of you are doing double duty as of late, working on COVID-19, and so I really appreciate everyone's efforts to continue to keep tobacco control on the radar, which we know smoking remains the leading preventable cause of disease and death in this country. But there's also a lot of emerging products, including e-cigarettes, which is going to be the topic today. But I'd be remiss if I didn't first start by just giving an overview of where we're at in terms of COVID-19 and tobacco use. And so as I bring up my slides, I do want to discuss where we are, particularly in the context of smoking. And so we know that COVID-19 is an emerging issue. And so with any emerging issue, we have to wait for the data to ensure that it drives our decision making. And so when it comes to smoking and COVID-19, we know that people who smoke are at increased risk of more severe disease. And so if you get COVID-19, the likelihood of hospitalization or even death are higher if you're a smoker. Now, whether smoking increases the risk that you'll get infected with SARS-CoV-2, which is the virus that causes COVID-19, is something that's uncertain right now. And that uncertainty also transcends to e-cigarettes. We don't know the extent to which e-cigarette use increases the risk of infection with the virus that causes COVID-19 or disease severity. But the bottom line here is that in the context of a pandemic, the best thing to do to protect your health is to quit smoking or using any forms of tobacco products anyway, particularly when it comes to youth and young adults. And so as we continue to keep our pulse on this issue of COVID-19, it's important to remember that there's a variety of different opportunities to reinforce tobacco control messages, and now is one of them, particularly when it comes to cigarette smoking, but also e-cigarette use. And when it comes to what the impact of the use of e-cigarettes or cigarettes has been in this pandemic, we don't quite know yet. We know from cigarettes that sales data shows that there was a marked uptick around early March, which we suspect was probably related to stockpiling of products in anticipation of shelter in place. And then things started to gradually wean down to about where they were before things things started to uptick in terms of sheltering in place in early March. And so we're starting to get a lot of surveys in the field now to do self-reported information from adults as well as youth to see what that long-term impact is in terms of use and cessation behaviors. But in the near term, it's critical that we continue to reinforce those public health messages around the importance of being tobacco-free, and that includes emerging products like e-cigarettes. And that's the topic that we'll talk about today, the rise of e-cigarettes and the implications for public health. Those of you who have seen me present before know that I like to compartmentalize my presentations and tell a little bit of a story, so you see where we're going. And so each of these compartments, what are e-cigarettes? Why are they so popular? Who's using them? Are they safe? What are the health effects among populations? And also importantly, what can we do about it? And this is the most important one for me as a public health official. It's very easy to pontificate from a federal perch and tell people something is bad, but it's another thing to tell people what they can do to effectively mitigate it. And when it comes to e-cigarettes, we're fortunate that we have a growing and comprehensive body of tools in our tool chest to help us combat this other epidemic facing this country, which is youth e-cigarette use. So without further ado, I'll start with how e-cigarettes have evolved in this country. So they first entered in 2007. And there's 4 generations currently. So we're dealing with the great grandbabies of the e-cigarettes right now. When they first started, they were first generation varieties that were disposable in nature. And once you used the liquid, you tossed it out. Then the second generation came along and these were refillable. And so you replaced the cartridge with the flavor, the nicotine concentration you liked. And then the third generation, larger tank style systems emerged. And these gave the user the most latitude to put in the flavor concentrations, but also to change the voltage. And so that had implications because if you increase the voltage, that can increase the temperature and the potential risk of harmful things being created when you're using the product. And then the 4th generation came along in 2015, and these are called the pod mods. And one of the most notable is Juul, but there's also Sworn is very popular, and that's the device in red there that looks kind of like a teardrop. And these are called pod mods because there's a pod that holds the liquid, and you can replace the pod with the liquid and nicotine concentration or our THC containing concentration of your choice. And so these products have really dominated the marketplace in recent years, as you'll see from this latest retail sales. And these data are sales in retail channels. So, you know, when you're watching a football game and it says, you know, this many million people have watched the show, well, that company also monitors sales. And so anytime you go to the Target, you go to the Walmart and you purchase a product, we can also record the sales that go over those scanners. And that's how we can tell how many e-cigarettes are being sold in the United States. And so if you look at this black dotted line, that's the sales of Juul. And so you can see that there's always been a lot of volatility in the e-cigarette market in this country, with certain brands going up, ebbing and flows, but Juul has really dominated the marketplace to the point where by the end of 2018, they had 75% of the market share. That being said, we're starting to see a lot of shift as the marketplace continues to be volatile. And so as we start to implement interventions, including some population-based regulations that may not cover all tobacco products, we're seeing the emergence of newer products that may not necessarily be covered by those policies. And a good example is Puff Bar, which is a new product that's a disposable variety. And so these are one of the few products that are remaining on the market following some national related policies that have ultimately resulted in some prominent use, particularly from the sales data, as we see puff bars among other disposable products. So I say this in reinforcing the fact that the e-cigarette marketplace is very volatile, very dynamic. Juul was not the first emerging product and it won't be the last. And we've been playing a game of whack-a-mole for many years in terms of market leaders based on the next new greatest technology that's coming onto the market. So now that we know what the products are, why are they popular? Well, I was on the Today Show last year, and the reporter had asked me, well, why are youth using these products? And I summed it up like this. And the advertising will lead a horse to water, the flavors will get him to drink, and the nicotine will keep him coming back for more. That's the trifecta of factors that are influencing youth use: the advertising, the flavors, and the nicotine. So if you want to cut off the spigot of youth use of these products, you have to have interventions that broach these key factors. And so when it comes to advertising, we know that about 70% of US youth report being exposed to e-cigarette advertising, particularly in the retail sector, but also on television, on the internet, and also in print media like magazines. We also know flavors are a major driver. 70% of youth who use e-cigarettes report using flavored varieties. 50% report using menthol flavored e-cigarettes. And we also know that flavors are among the primary reason that youth reports first starting to use these products, and most of them start with a flavored product before they transition to other other products. And then finally, the nicotine is another key factor here. We know that nicotine is highly, highly addictive, but we've also seen an evolution of the type of nicotine in these products, and that gets us to nicotine salts, which is kind of a complicated issue. So I'm going to distill it down to you. Think back to your high school chemistry class. Do you remember the litmus test where you took the little piece of paper and you put it into a liquid, and if it was very acidic, it was very red, and if it was very alkaline, it was very blue. So most of the nicotine in regular e-cigarettes before the pod mods that normally contain these nicosalts, as well as regular cigarettes and cigars, they had something called free-base nicotine, which is very alkaline, so very blue. And that also means that it's very volatile. And so it's going to be very harsh to the user. And so what did the tobacco industry decide then? Well, Juul invented this notion of nicotine salts in their patent when they introduced the product. And they realized that if you lower the pH and make it more acidic, it's going to be less harsh to the user. And so less harsh means higher levels of nicotine can go down a lot easier. And so by lowering the pH and making these nicotine salts, they effectively created a form of nicotine that allows you to put higher doses of nicotine in the device. And so why is this concerning for kids? Well, it means that nicotine naive populations, particularly those who have never been exposed to nicotine, now have a mechanism that allows it to go down a lot easier and at higher concentrations. And this is really what we've seen mirrored in the sales data as well, that the concentration of nicotine in e-cigarettes has increased since 2015 when these pod mod devices led by Juul entered the US marketplace. So it's not just that there's nicotine, but it's very high levels and it's a new form of nicotine. So who's using them? Well, it's no surprise that the advent of these new products has led to skyrocketing rates of use among youth. So these are data from the National Youth Tobacco Survey, where we started measuring e-cigarettes back in 2011. And we saw an increase back between 2011 and 2012, and CDC has sounded the alarm at that point. So it's been nearly 8 years since we have been reinforcing our concerns around this increase of youth use, but unfortunately it's continued to increase. We did see a decline in 2016 that held in 2017. We believe this was a result of the implementation of evidence-based strategies. We started to see a lot of youth access restrictions at the state level, a lot of including e-cigarettes and smoke-free policies, mass reach health communication campaigns, warning people, particularly kids, about the risks. But then something changed, and in 2017, we saw the beginning of an uptick, a meteoric uptick. And you'll recall that this coincided with the skyrocketing sales among Juul that I showed you on the previous slide. So you effectively had a new product that was very appealing, could be easily concealed by youth, that resulted in continued increases in youth use to the point where we have a several 100% fold increase between 2017 and 2018 alone, and then further into 2019, to the point where we had 27.5% of US high school students that were using these products. So to put that into context, 27.5% of our nation's high school students and about 3.2% of US adults use these products. So a marked variation. That's why we're so concerned about youth use of these products, because it's several fold higher, and it's actually going in a different trend. Adult use was actually going down up until 2017. There was a slight uptick in 2018. We believe this was because of young adults, and they were interested in the same things as youth around these pod mod devices, including Juul. And so there's a slight uptick, but regardless, you still got 3.2% of adults that are using these products compared to the markedly higher rates among youth. There's also higher rates among young adults. So young adults 18 to 24, it's about 8% compared to 3% among adults in general. And it's also important to note that people are using other substances in these products. So it's not just these nicotine-based products. We've seen an uptick in the use of THC-containing products, particularly as we've seen recreational and medicinal legalization of e-cigarettes and of THC in many states, which is the primary psychoactive substance in marijuana. And so as you have legalization, of course, there's broader supply in the marketplace, which makes it easier for youth and others to access it. And so we know from the available data that about 1/3 of youth in the United States who use e-cigarettes report that they've ever used THC in the device. And that includes even middle school students. About slightly more than 1 in 5 of middle school students who are using e-cigarettes report using THC in the devices. So that's 12, 13-year-olds. So we really have an issue here, not only of just e-cigarettes as a broader class, but also the use of THC in these devices. So now let's segue into are they safe? What are the health effects? So when it comes to this issue of e-cigarettes, there's a lot of debate. Are they public health promise or are they public health peril? What is the net public health impact of these products? And when we're considering that net impact, we have to consider both youth initiation and also adult cessation. And so right now there's been a lot of attention around youth initiation because we've seen those skyrocketing rates of use. But it's also important to note that e-cigarettes do have the potential for harm reduction among adult smokers if they use the products to transition completely. But in that context, it has to be evidence-based and proven first, which we're not yet there. And it's also important to note that any benefit among adults can't come at the expense of the escalating rates of youth use. And so right now, this scale is very much tipped, where we have large burden among youth and we have an unproven benefit among adults. So when I say unproven benefit, I'm talking about studies that have assessed the effectiveness of e-cigarettes for helping adult smokers quit. So as I noted before, and if adult smoker were to transition completely from regular cigarettes to e-cigarettes, there'd be a net benefit, right? The cigarettes have 7,000 chemicals and 70 carcinogens. E-cigarettes don't have nearly that many, but that doesn't mean they're risk-free. There's still harmful ingredients of the aerosol. But to that end, if an adult smoker were to transition completely, there'd be a benefit. But in order for a benefit to occur, you have to quit completely. And right now, the science is uncertain around the efficacy of e-cigarettes for cessation. There's been several Cochrane reviews, including a report by the National Academies of Science, Engineering, and Management, and also the recent Surgeon General's report that came out in 2020 that concluded that e-cigarettes as a general product class have not been effective to help people quit and that more research is needed. The report did note that certain types of e-cigarettes, including those that include more nicotine and those that are used more frequently, may have greater efficacy in terms of promoting cessation, but the science, again, is not conclusive and more research is needed. But on balance, we talk about risks as well, of which there are many. And so when we talk about this net public health risk or benefit, right now, these are the potential risks. Gateway of e-cigarettes leading to smoking among youth. We now have about 24 studies from multiple countries, including the United States, Canada, and the United Kingdom, showing that youth who use e-cigarettes are more likely to smoke regular cigarettes in the future. Does that mean that every kid who uses an e-cigarette is going to go on to smoke? Absolutely not. It's about an 8-fold or so increase depending on the study. But it's one more egg in our basket of concern around this fact that e-cigarettes could be a gateway to more harmful combustible tobacco products. And when it comes to youth, no tobacco product use is safe, irrespective of whether it's combustible, non-combustible, or electronic. We don't want them using any product. So even if they don't transition on to regular cigarettes, e-cigarette use is still a problem among kids. There's also concerns about relapse among former smokers and that it will diminish the chances that a smoker will quit or discourage a smoker from using those proven quit methods. We've got 7 FDA-approved medications that we know work to help people quit, but a lot of times people are going towards those bright, shiny objects, including e-cigarettes, that aren't proven for effectiveness. And so it's really critical that our first line of defense is these proven interventions, that we have the science and the randomized trials that show they work. There's also concerns over exposure to secondhand aerosol from e-cigarettes, particularly for vulnerable populations. We know that e-cigarette aerosol is not harmless water vapor. It can include harmful, potentially harmful ingredients, including volatile organic compounds, ultrafine particles that can be inhaled very deep into the lung. Certain flavors can be problematic for health, and even heavy metals and some cancer-causing chemicals have been identified in this aerosol. And so it's not just a risk for the user themselves, but also for bystanders who may be exposed to this harmful aerosol. There's also concerns over glamorization of tobacco use in the media. E-cigarettes are exempt from current restrictions around prohibiting the advertising of cigarettes on TV. So e-cigarettes can be advertised on TV. We're seeing a lot of direct or indirect advertising through the e-cigarette companies, as well as influencers on social media and the internet. And it's using the same themes and tactics that we know led to initiation of regular cigarettes. So we know independence, rebellion, sex, you name it, those same themes that the industry knows works to influence kids for regular cigarettes is now being used for e-cigarettes. And then finally, there's also concerns around poisonings among users and non-users. We have seen an increase in the rates of calls to poison control centers for e-cigarettes. Up until EVALI hit, and I'll talk about EVALI shortly, we were averaging about 4,000 calls nationally each year. And interestingly, about 50% of those calls were for children less than the age of 5. And so you can have poisonings from not only ingestion of the liquid, but also dermal exposure and other factors, including including some deaths among infants who have ingested that liquid. And why is that? Well, we know nicotine is not a benign substance. It's very toxic at certain levels, and that's why it's very concerning, not only addiction, but particularly for those types of poisoning related matters. And so I mentioned EVALI earlier, and that's, it stands for e-cigarette or vaping product use associated lung injury. And this was an investigation that CDC coordinated across states. We started receiving initial reports from the state of Wisconsin in early August of 2019 around a cluster of young adults with very severe lung injury. And the common factor was reporting the use of e-cigarettes. And that began a several months long investigation. The state of Illinois followed with reports shortly thereafter. And by February 18th, when we stopped collecting this information routinely from states, there was 2,807 cases of EVALI in all 50 states, DC, and 2 U.S. territories, Puerto Rico and the U.S. Virgin Islands, as well as 68 deaths in 29 states and DC. It peaked in September, and the case counts have drastically reduced since that time. And that was primarily because of the public health warnings around the risk, but also the science showing what the cause of it was. And in this case, it was THC-containing products from informal sources, and particularly vitamin E acetate, which is a diluent that's used in THC-containing products to thicken the liquid, to create more volume. And it's particularly used in informal settings or illicit markets. And so if you think about, how would you, if you want to make more money and create a larger volume for less cost, what do? Well, you dilute the product. And so that's effectively what vitamin E acetate was being used for. And vitamin E acetate is used in some products like skin lotion and other things, but that doesn't mean that it's safe to inhale. And so that was found to be strongly linked to EVALI, although at present we can't rule out the potential contribution of non-THC containing products for some of the EVALI cases. That being said, it's important to make a key distinction between the youth epidemic and the EVALI epidemic. These are actually two very distinct things, and the interventions to address them are going to be different. And so we don't want to conflate them. So the key distinctions are the youth epidemic that I've already been talking about, of course, primarily affects youth, so younger than age 18. It primarily results from nicotine-containing products like Juul, and it's obtained from formal sources, brick and mortar stores, convenience stores, gas stations, and it's caused by multiple factors. Remember that analogy, the advertising, the flavors, the nicotine. EVALI is very different. It primarily affects young adults, 18 to 34. About 60 to 70% of our cases were actually less than the age of 34. Only about 15% of all EVALI cases were actually less than the age of 18. It was THC-containing products primarily obtained from informal sources. So it's not necessarily a back alley drug deal. It's people that you know. In many cases, it was social circles and friends and family that were supplying these products to individuals. And also, again, as I noted, it's primarily linked to a thickening agent, which is vitamin E acetate. So when it comes to any of these adverse health effects, whether you're talking about the youth epidemic or the EVALI epidemic, the good news is that we know what we can do about it to address it. And so whether it's clinically focused or removing potential toxicants of concern in the context of EVALI, we also know that population-based strategies work. And that's really one of our primary levers when it comes to addressing the youth epidemic in this country. And so it's been said that an ounce of prevention is worth a pound of cure. Benjamin Franklin said that several centuries ago now, and I couldn't agree with him more. Smart guy, because it still works in the context of public health. We know that prevention is a hell of a lot cheaper than cleaning things up on the back end, and so prevention has been a very key lever when it comes to public health for many years, and also tobacco control. And so early on in my career, as you noted, Chelsi had said I've been doing this for 15 years, so I clearly started as a fetus. But when you do this long enough, you appreciate the fact that tobacco control has the luxury of over a half century of science showing us what works. Not all risk factors have that luxury of evidence. And so when it comes to tobacco control, we have those evidence-based interventions. And if you inoculate the population with those prevention measures, you're going to effectively prevent and also help reduce the use of products. And so when it comes to tobacco control more broadly, what is that? It's price increases, smoke-free policies, cessation access, hard-hitting mass media campaigns. And when you implement it as part of a comprehensive booster in a population-based vaccine, if you you will, then it helps to effectively prevent the use of these products. And so when it comes to the issue of e-cigarettes, we don't need to reinvent the wheel here. We just need to grease that squeaky wheel and ensure that our interventions address the diversity of products. Again, we have that evidence base. We know what works. We just have to be nimble and modernized to ensure that e-cigarettes are included. And so how can that happen? Well, it can happen at the national, state, and local levels. At the national level, there's federal regulation by the FDA that they got in 2009 from a congressional act, and that covers the manufacturing, marketing, and sale of tobacco products. And in 2016, they brought e-cigarettes under that jurisdiction. But importantly, that act doesn't preempt states and communities from acting. And indeed, that's been the bread and butter of tobacco control for decades. Remember back in the 90s, California was implementing those smoke-free policies that everyone literally laughed and said, there's no way we're gonna have that in our communities. And at that point, people were just fighting to separate smokers from non-smokers within the same room. You remember going to the Pizza Hut and you had half the room that was smoking and half that's not, and that was the strategy. But now we know better. We have the science showing there's no risk-free level of secondhand smoke. But we know the interventions that work, and the state and local momentum is critical. And that's why preempting state and local action is so problematic, because you need that local level action with locally salient stakeholders and gatekeepers that understand constituents and understand the key arguments to inform public health policy. And so what can be done at the state and local level when it comes to e-cigarettes, including them in smoke-free indoor air policies, restricting youth access, licensing retailers, price policies, package requirements. There's a lot of things that can be done, including some that aren't necessarily under the jurisdiction of FDA. So before the Tobacco 21 law that I'll talk about in a bit, states and communities implemented those strategies. Beginning in 2005 in Massachusetts, we were increasing the age of sale to 21. Same thing with some of these emerging strategies like flavor prohibitions. Again, it's galvanizing from the bottom up in terms of local and state action. And so where are we in terms of some of these policies? This is a slide of policies that prohibit e-cigarette use in indoor environments. So you can see the dark green is those that include e-cigarettes, as well as regular conventional tobacco products being smoked. And so a comprehensive policy is the trifecta of work sites, restaurants, and bars. So that's our gold standard. So if they've got a teal color, that means they prohibit smoking. But if it's that dark color, it's e-cigarettes and smoking. But you see down in the tobacco belt, which I call it, we don't have any comprehensive policies. There's some with local level momentum that have made really great progress. Alabama is a great example of that, as well as Mississippi and Texas as well. But again, those state level policies have not been implemented, in some cases because of preemption. And so it's really essential to reinforce that although we have 60% of the population covered by smoke-free policies, 40% of the population is unprotected, and even sizable proportion can still be exposed to e-cigarette aerosol in indoor environments, which we know carries risks. We also know there's some efforts around price with e-cigarettes. There's increasing states that are taxing e-cigarettes. When it comes to regular cigarettes, increasing price is the single most effective intervention to reduce consumption, and it's particularly effective at preventing youth initiation and use. And so we've seen similar strategies when it comes to e-cigarettes, but there's a lot of different strategies that are being implemented when it comes to taxation, some better than others, but the primary point here is that it has to be a substantial increase. So, some states have they tax by the volume of the liquid. So if there's only 1 milliliter of liquid and you're taxing it a nickel per milliliter, it's not going to amount to much of a tax. And so it's not going to be very impactful. And so a meaningful tax increase that can effectively prevent youth initiation is really key here. And also it's important to note that there's a lot of ways that you can increase price without necessarily taxation. Minimum price laws, preventing buy downs and incentives that are given to the retailers by the industry are multiple ways that you can actually increase price without necessarily taxing the products. But in addition to these tried and true strategies that I talked about in terms of modernizing the vaccine, we also have some novel strategies. And this is really important because as a tobacco control community, we have to be nimble and mindful of the evolving landscape. And so as the product landscape changes, so must we in terms of the interventions that we implement. And Tobacco 21 is a great example of that. So these policies started to crop up at the local level, as I said, back in 2005. But we also ultimately, up until last year, had 19 states that implemented these policies. And so, are these going to be a panacea to solve the youth tobacco product use epidemic? Absolutely not. But it's one more a step in our comprehensive approach to effectively reduce youth use. And we know that young adults are frequently conduits to supply chain for our youth, particularly those 18-year-old high school students that can legally buy the product and then supply it to youth. And so Tobacco 21 makes sense when it comes to preventing youth initiation of these products. But again, it's not a panacea, and we need a comprehensive approach. And so as I noted in December, the federal government implemented a Tobacco 21 policy that now covers all states, and it includes e-cigarettes, which is a step in the right direction around universal coverage. And it harkens back to that point I made before. We galvanized from the bottom up. Remember, local policies in 2005, state level policies started to proliferate around 2015, and now we have a national policy in 2019 as social norms shifted and people understood the benefits of these policies. We're also seeing developments on flavors. So there's been a lot of local level jurisdictions that have prohibited flavors, which makes sense. When you think about that data I presented before, 70% of youth e-cigarette users report using flavored devices, and it's among the primary reasons youth report using the product. So if you want to cut off that spigot, prohibit the availability of flavors. And so several jurisdictions at the local level have done this across the country, and an FDA in January 2020 implemented a policy prohibiting certain types of flavored e-cigarettes on the market, but it wasn't a ban of these products. Companies can still submit an application to get them back on the market, but they have to demonstrate that it's a benefit for public health, which is a pretty tough standard in that regard. And importantly, there were some exemptions, including menthol and tobacco flavored e-cigarettes, as well as certain non-cartridge based e-cigarettes, including disposable products like puff bars. And so we continue to monitor the data and the National Youth Tobacco Survey to see what the impact has been within the past year in terms of any potential shifts in youth behaviors around e-cigarettes to help inform future decision-making around national regulations. But in addition to policies, everybody plays a role. And the Surgeon General's report, I'll acknowledge this back in 2016, and then the Surgeon General's advisory on e-cigarettes in 2018 reinforced this as well. Everybody plays a role, whether it's the community and states, tribes and territories, and also teachers and parents and health professionals. And so we know that key ways that health professionals can learn about these issues is to learn about the different shapes and types of these products, to ask about the products when screening potential patients, educating patients about the risks of these products, including e-cigarettes, and also encouraging patients to quit. And so for free help, patients can visit smokefree.gov or 1-800-QUIT NOW to address the diversity of tobacco products, and that includes e-cigarettes. But importantly, in the context of youth, we've seen a shift in our paradigm. So for years, we always focused on prevention, knowing that sizable portion, 90% of adult tobacco users begin before the age of 18, and 99% begin before young adulthood. So the key is to cut off that spigot in terms of initiation. If you can prevent them from stopping before age 18 or even age 24, you're going to prevent that next generation. But now we have so many kids that are using products, particularly these emerging products, that it's critical that we start to explore cessation strategies. And so when it comes to regular cigarettes, there's no FDA-approved medications when it comes to preventing even conventional cigarettes among kids or helping them quit smoking. We know that behavioral counseling from a clinician can help prevent the use of tobacco products, but we're also starting to look at some emerging strategies, and one of those is smartphone-based cessation resources. And so the Truth Initiative has an app that they've introduced, and some emerging evaluation data suggests that it may be effective to help youth quit the use of e-cigarettes. And also the National Cancer Institute and Smoke Free Teen by the government has text-based programs to address this issue of e-cigarettes. And this really gets back to that notion of the tobacco control community and public health more broadly, being nimble and modernizing with the landscape and ensuring that we're reaching kids and communicating with them in the way that they communicate. And we can't maintain this archaic notion of quit lines and that a youth or young adult is going to, pick up the rotary phone and call for help. We need to understand that people are utilizing and processing information in novel ways, and so public health has to adapt. And so these smartphone-based apps are really an emerging new strategy that holds promise in terms of helping to promote cessation among those 5 million American youth who are currently using e-cigarettes. So before I close, I just want to note that, we've made progress, but challenges remain in a lot of contexts, including the diversification of tobacco products. As I noted, e-cigarettes were not the first, but they won't be the last. Heated tobacco products are the latest emerging products to enter the marketplace. These contain actual tobacco leaf, but the manufacturer claims that the tobacco is heated as opposed to getting to combustion or burning. CDC calls these heated products because we're not quite convinced that burning actually does not occur. These have been introduced by Altria, which folks in Virginia are very familiar with. And actually the test market for these products was in Atlanta, down the street from CDC. So this is to be seen in terms of data around uptick. Use among adults appears to be fairly low, about 1% to 2% of adults. But when it comes to youth, we're still waiting on data to see what the prevalence. These systems are fairly expensive, over $100. But these electronic factor, could contribute to potential initiation among youth and young adults. It's touted as a harm reduction strategy, but right now there's no evidence that these products are actually effective at helping people quit. So in addition to those products as well, I should also note that there's other emerging things like nicotine pouches, which are also entering the market. You may have seen those test marketed in some populations. Those, again, you still have concerns around nicotine exposure. When it comes to kids, nicotine is not only highly addictive, but it can harm the developing adolescent brain, particularly the prefrontal cortex that's responsible for learning, memory, attention, cognition. So nicotine is not good in any form for kids. And so just keep that in mind. And again, as the landscape for tobacco products diversifies, so must we, and we have to ensure that our strategies address these diversity of products, including current ones, but also future ones like these heated products, as well as these nicotine pouches, which are now infiltrating the market. We also know that we also have people working against us on a daily basis to advertise those products, and that includes the tobacco industry. So the state revenue coming in for tobacco control is about $27.3 billion, and another $12.8 billion coming in from federal cigarette tax revenues. And what is the industry spending? About $9.4 billion every day every year to advertise cigarettes and smokeless. So what does that work out to? It's about $24 million a day, or about $1 million per hour to advertise their products. And think about these products that, when used as intended by the manufacturer, I'm talking about cigarettes, kill half of their users. Imagine if that was a bottle of shampoo or something else. We as consumers would be livid. We would have pitchforks and torches out in the streets, but you have a product that, when used as directed by the manufacturer, kills half its users. That's highly problematic. And these are the same individuals that are now selling these emerging products like e-cigarettes. And so you have to be very careful around these claims around harm reductions or potential benefits, including the industry trying to get into school-based curricula, making it seem like they're doing something good. Remember that these are the same people that were convicted in federal court. They're adjudicated racketeers that have been convicted of deliberately misleading the public about the risks of their products. And so this is very important as a public health community to understand that each and every day we have an entity that is working against our efforts to promote a product and to find replacement users. And so what is a good replacement user? Youth and young adults, because they have the longer lifespan. And so as you continue to see the industry finally come to terms with the fact that e-cigarettes, that regular cigarettes are dangerous, here they swore under oath that nicotine was not addictive. They've come full circle now, acknowledged it's addictive, but now they want to introduce new products as a potential harm reduction, so they say, to benefit adult smokers. But irrespective of any unproven benefit around that harm reduction that hasn't yet manifested at the population level, we have an epidemic of youth use of these products, and we have a public health obligation to mitigate that use. So with that, I'm going to close with my 5 key points. So if I put you to sleep, you can rise from your slumber. Here's the Cliff Notes version, and you can take a picture to let your boss know that you stayed till the end. Here we go. E-cigarettes are a tobacco product that produces an aerosol by heating a liquid that typically contains nicotine as well as harmful chemicals. Why is it popular among youth? Remember that analogy. The advertising will lead a horse to water, the flavors will get him to drink, and the nicotine will keep him coming back for more. That's the trifecta that's promoting use. So if we want to address it, implement interventions that broach those. When it comes to use, we know e-cigarette use is markedly higher among youth than among adults. E-cigarettes have been the most commonly used tobacco product among youth since 2014, and we now have 27.5% of high school students compared to only 3% of adults. So that's why we're so agitated around the prominent use of e-cigarettes among kids, because this is a population for which there's no redeeming aspects of the products, and they're the ones that carry the greatest burden. And when it comes to health effects, the bottom line when it comes to kids is no form of tobacco product use is safe, irrespective of whether the product is smoked, smokeless, or electronic like e-cigarettes. And so importantly, what can we do about it? As the tobacco product landscape continues to diversify, it's important that we modernize our strategies to adapt. And that includes being nimble and ensuring that our interventions address the diversity of tobacco products that are on the market, including keeping an open mind for those different products that continue to enter the market and are novel and not necessarily the same as conventional cigarettes, but delivering nicotine in ways that could be detrimental, particularly vulnerable populations such as youth. So here is my last slide in terms of more resources that are available. CDC prides itself on having resources available on a variety of topics, including tobacco control. So if you want content on e-cigarettes, cdc.gov/e-cigarettes. The Surgeon General's report and the advisory are also available on e-cigarettes.surgeongeneral.gov. There's a lot of great resources on there, including provider cards for health professionals, cards for parents to talk with teens about e-cigarette use, infographics, social media content. We're now on every single social media platform, including Pinterest. So if that doesn't get you excited, I'm not quite sure what will. And finally, there's also some key information on EVALI if you're interested there, cdc.gov/lung injury. As I noted before, that epidemic is now back down to baseline levels after we found the problem, but we continue to monitor at CDC to ensure that we don't have a resurgence of the EVALI outbreak. So with that, I'm going to close my mouthpiece and I'm going to open it up for hopefully at least 10 minutes of questions, and I look forward to some fruitful discussions. Thanks, folks.
Well, Dr. King, thank you so very much for being here. If it wasn't for COVID, we would probably be in a room right now just giving you a round of applause. So here's one for me virtually. I'm sure our webinar participants are doing the same. Thank you for the information, for walking us through. And so yes, we have questions that are coming in. A few things I want to share really quickly is that this is being recorded and will be available on the Prevention Connections website, as well as the Virginia Foundation for Healthy Youth. So you will be able to not only see these slides, but also hear from Dr. King. So let's jump in. Are there still cases of EVALI occurring? Is CDC still collecting them? Do we know if those cases have gotten those who have gotten cases have been affected more with COVID?
Okay, yes. So I'm happy to answer that question. I assume the person meant EVALI and not E. coli. Must be that spell check. But with EVALI, the bottom line is in February, CDC stopped requesting data on self-reported cases from states. And so when we stood up our emergency response in August, we set up a platform for standardized questionnaires to be administered across health departments across the country. And then states submitted that information to us every single week. And so CDC stopped collecting that in February because we were seeing lower levels of cases and there was no longer a need for that level of reporting. That being said, we're still monitoring it. And the way we're doing it is through something called syndromic surveillance. And so syndromic surveillance allows us to see what's happening in emergency departments across the country. And we can see records of hospitalizations and emergency department visits for factors related to e-cigarettes as well as severe lung injury. And so we've continued to monitor that. And what we've seen is that it was a similar pattern along the self-reports where we saw a peak in September and cases continue to decline since that point. That being said, we continue to see a few sprinkled cases of EVALI across the country. There's some reports in multiple different states, but again at these baseline levels. And I'll note that the syndromic surveillance data actually suggests that there was always some cases of EVALI occurring even before the outbreak that we saw in August. And so what does that tell us? It's probably multi-factor etiology. And again, with the self-reports, we saw a lot of people who reported using THC-containing products, but a small minority, about 15%, reported using nicotine-only products. And so it's possible that these non-THC-containing products could be contributing to a minority of cases. But needless to say, CDC is still monitoring it, and we have our finger on the pulse. And if we do see an uptake, we're prepared to message to the public. When it comes to COVID-19, there are some very similar signs and symptoms. And so I'll note that EVALI is a diagnosis of exclusion, which means that the way we diagnose this is that we rule everything out. And so it's important that now, with the advent of COVID-19, that people who do have suspected EVALI are tested for COVID-19, so we can effectively rule that out. That being said, that has been occurring. There was a report out of California just published last week in CDC's Morbidity and Mortality Weekly Report, which identified a handful of cases that were originally suspected to be COVID-19, but then after testing, they were negative and they were confirmed as EVALI. And so it really reinforces this notion that healthcare professionals have to be vigilant and continue to test for a variety of things, including, the upcoming flu season as well in the fall. There's a variety of things that have similar signs and symptoms that complicate our ability to determine what the ultimate cause is. But the good news is we have tests for many of these, including influenza and COVID-19, to help rule them out and determine whether something is in fact EVALI.
Thank you, Dr. King. The next question, we're receiving questions live as well as taking some from those that you submitted during the registration process, is Puff Bar, the disposable flavored e-cigarette that has taken the industry by storm, emerging as a new teen favorite and raising the billion-dollar question. Is Puff Bar the new Juul?
So too soon to be certain, but what we do know is that it's certainly following similar patterns to what we saw with Juul back in 2015, 2016. And as I noted in my earlier slide, we can't rest on our laurels, folks, here. And a lot of times we get so focused in tobacco control on the bright, shiny object, but I remind people that Juul is not the first and it won't be the last bright, shiny object when it comes to the e-cigarette marketplace. And Puff Bars are a good example of that, or even products that resemble Puff Bar. Remember that Juul set the stage for these pod mod-based products with nicotine salts, and then everyone followed suit because it did well in the market. And so if imitation is the greatest form of flattery, I suspect the folks at Juul must be quite flattered. That being said, now you see this innovation with Puff Bars where the marketplace is shifting back towards disposables. And so you're likely going to see other entities start to copy that as well, because it's one of the few products that can infiltrate the market with certain characteristics, including flavors. So we're monitoring the use of these products in a variety of ways, including self-reported surveys from youth, including in the recent 2020 National Youth Tobacco Survey, which had to leave the field a bit early because of COVID-19, but we did get enough data that we're prepared to release nationally representative estimates later this year. And we're also looking at rapid response mechanisms like retail sales data. And that's, remember I told you about the retail scanners, you can see the brands. Well, you can also see the different types, and that includes Puff Bar. And so what we do know is that Puff Bar is registering in both the self-reported surveys among kids and also among the retail sales data. And it's going to be important for us to monitor within the coming months and even years to see what the impact is. But we're certainly seeing a lot of those same warning signs that we saw with Juul, as well as Sworn on the West Coast and now the broader part of the country with some of these emerging products, including Puff Bars and others. But Juul still holds the preponderance of the market share. There's still about 60% of the e-cigarette marketplace. So Puff Bar is nowhere near that, but different products have certainly been etching away at Juul's dominance over the past year or so.
Thank you. Next question, Dr. King. Is there any indication at all yet that flavor bans reduce e-cigarette use?
Yes. So there's a growing number of studies, again, at the local level that have demonstrated that these types of product restrictions are effective. The data is not necessarily robust yet because the policies haven't been around that long, but there's several initiatives currently underway, including an initiative funded by Bloomberg in coordination with the CDC Foundation, which is assessing the flavored policies in a variety of states as well as communities that have implemented the policies over the past year or so. And so the evaluations are currently underway, but the preliminary data, including those from some of the early adopter communities, have demonstrated that these policies are effective. But I will note that a policy is only as effective as its enforcement and its comprehensiveness. And so as we know with tobacco control, if you start to make exemptions, you leave the opportunity for loopholes for people to take advantage of those policies. And so an example is Tobacco 21, when you exempt the military. Those types of exemptions leave the the door open for that could potentially mitigate the impact, the full impact of the policy. And the same goes when it comes to flavor policies. We know that youth use a variety of different flavors, and that includes menthol. About 50% of US youth who use e-cigarettes report using menthol or mint-related products. And so it's ultimately critical that we really be mindful of monitoring the data, ensuring that our policies address the products and the scope of different characteristics that are being used among youth to help mitigate this public health issue.
Next, any advice on how to best address youth use of vapor products as schools open up in the fall? Schools will likely be overwhelmed as usual, but with the current events, it may be even harder to partner with schools on tobacco vapor product prevention.
Yeah, absolutely. And it's a really good point. And we're really delving into uncharted territory when it comes to COVID-19, that a lot of these platforms are typical tobacco control interventions in schools are not necessarily virtual. So an example is tobacco-free policies. You know, when adequately enforced, tobacco-free policies are very effective at helping to mitigate the access and use of these products on schools. And so when you're in a virtual format, you know, it's up to the home. And so that's why it's really important to educate parents about not only identifying these products, but also knowing the health risks. And to that end, there's a lot of resources out there to help educate parents. But of course, we also have to educate teachers and also youth. And to that end, there's a variety of evidence-based curricula that are starting to be released by a variety of different entities, including Stanford University, as well as the University of Texas, Austin. Catch My Breath is the curricula. And it's all electronic, and it can be used in settings, including in the home and virtually, to educate youth about the risks of these products. One warning that I have around these curricula is you have to make sure you know the source. And a lot of times the tobacco industry, including Juul, have tried to create a curricula or otherwise fund it through other means. This is problematic. We know that industry-funded school curricula are not effective and could even increase youth use of the products through inadvertent or advertent promotion. And so it's really essential that you know the source of these types of curricula that you're using. But bottom line is, when it comes down to the youth issue, there's some virtual resources, including those curricula. And also, if you go to the websites that I shared earlier, there's a lot of different resources and smoking cessation-based apps that can assist parents as well as teachers in not only educating youth about the risks, but also importantly, helping them quit if they're currently using them. Unfortunately, a lot of healthcare is also shifting to a virtual format. And so it's not problematic now for a pediatrician to be able to get on the Skype chat or the Zoom meeting with patients, including pediatric patients, to deliver that behavioral counseling, which we know is effective to help prevent youth initiation of tobacco products, including e-cigarettes.
Thank you. I think we have time for about 2 more questions, Dr. King. So here's one. As racial inequality is all on our minds, how does health equity and equality relate to one another? And how do you feel it's best to reach teens most at risk or susceptible to vape use?
So one of the most effective ways to reach youth is really through mass reach health communication campaigns. We know that that is one of the most effective interventions to really get the message to youth. And to the point made earlier around reaching kids in a way that they can understand and relate to. Kids are using social media. They are using different electronic platforms, including through the internet. And so this is an ideal opportunity to deliver evidence-based cessation messages, in addition to the tried and true standards we've used through television and radio and print as well. But we've got an outstanding opportunity now to really leverage the way that youth communicate to deliver public health messages. And so that remains a key conduit to deliver that information using relevant themes. You know, we don't want to scold youth. We know that doesn't work, but instead we know that messaging around empowerment to galvanize youth, particularly to work against the industry who is taking advantage of them, and also messaging around the short-term acute effects of e-cigarettes and other tobacco products. A lot of times kids don't look to those long-term risks. Talking about things like coronary heart disease and cancer never really registered with a lot of kids over many years when we had conventional tobacco products, but reshifting the paradigm to focus on those key themes that we know work are effective. And again, it has to be part of a comprehensive approach. There's no single panacea, but those mass reach health communications coupled with those other interventions we've talked about, tobacco 21, flavor prohibitions, smoke-free policies, and price increases are going to be the most effective to create an environment where these products are less acceptable and less likely to be used by youth.
Well, Dr. King, with 1 minute left, I want to say thank you for your time today. Thank you for sharing your expertise of almost 2 decades in this industry, in this world of learning about everything tobacco related. So I want to say thank you. As we close, to all of our webinar participants, I do want to give a special shout out to Michael, who is behind the scenes as our Zoom expert today to ensure that all your sound, your video was done correctly. To the Virginia Foundation for Healthy Youth and Prevention Connections, thank you for hosting and organizing. Thank you for ensuring that there was a way that we can continue to educate even with the pandemic around us. As I shared, today's webinar will be available on both websites, Prevention Connections and Virginia Foundation for Healthy Youth. And lastly, you will receive one more email from us with a post survey from the Virginia Foundation for Healthy Youth. Please, please fill it out. We want to hear from you. We want your feedback as we continue to develop content for what's next. So thank you all so much. Again, thank you, Dr. King. Thank you, Prevention Connections and Virginia Foundation for Healthy Youth, for today's webinar. Have a wonderful weekend.